Good afternoon. We're here with Dr. Teresa Frankovich for the June 1st media availability. Thank you for being here with us.
Thank you.
A lot of these questions today are about this weekend's protests, so I'm going to launch right in.
Okay.
Considering that minorities are victims in higher numbers proportionately for both COVID and police brutality, can you compare the public health crisis of COVID and the public health crisis of structural racism?
Well, I'd say it's part and parcel of the same thing, really. Structural racism is truly a public health crisis. We certainly notice that it is a large driver in social determinants of health that we address in public health all the time. What we're seeing with COVID and the playing out, for instance, of deaths in African Americans with COVID being twice what you would expect based on proportion of the population, highlights the fact that issues like structural racism have an impact on long-term health for populations. And it's incredibly important that the underlying root, structural racism, is addressed to help have an impact in some of these other health outcomes that we see, whether it's chronic disease burden or it's something acute as in COVID.
Thank you. Many national news sources are referring to the murdering of unarmed black men as a pandemic. Do you agree with that?
Well, first I just want to say I appreciate residents of Humboldt wanting to highlight the injustice that occurred with Mr. Floyd, and obviously it not being a single case that we're referring to. In the term of whether it's a pandemic is really sort of semantics. Pandemic typically refers to a global outbreak of an illness or disease, and in this case, I probably can't comment well enough on internationally what is being seen across the board in this event. What I can comment on is nationally here within the United States, and I would say that this is, to me, is really the correct term might be more endemic, meaning that this is a constant presence, and it has been in our country, as far as I can tell, for at least the last couple hundred years, more than that at this point. And so it's been a really challenging piece of our American history, violence against black individuals in our population, and I think we're seeing this just play out now on a much more public stage because of the availability of technology now that provides evidence of these instances. It is certainly not a new concept to any of us that this is occurring. And so I think what we may be seeing is an increase in this violence, but again, it's difficult to say because we're just made more aware of it now than we've ever been really in this country.
Thank you. This weekend with the protests and groups of people gathering, is public health concerned at all that there may be an increase in cases or increased exposure risk for those in attendance? Do you think that residents did a good job of masking and trying to maintain social distancing during demonstrations?
Well, I think in terms of a good job, I think it varies. Some of the images I've seen have suggested that there were certainly people masking and really attempting to have some distancing, and others who were not. And so again, whenever we bring large groups of people together, it's a concern. Being outdoors is an improvement, wearing masks is an improvement, distancing is an improvement, so those factors are helpful. But of course, we're always concerned about large gatherings of individuals at this point.
And you just addressed this question, but the next question is, do you feel encouraged by the amount of people wearing face coverings at the protests?
Well, I do have to say that compared to what I've seen in some of the national footage, I think we've done better here at that, and I do find that encouraging. And just the fact that people can talk about and demonstrate against injustice, but also at the same time being aware of trying to protect their fellow residents, I think made me feel much better about our residents and our county.
Considering the possibility of further COVID spread resulting from the large protests we saw over the weekend, would you recommend that people who attended the demonstration schedule a COVID test at Redwood Acres, and would the masking policy alone be enough to limit the transmission in those situations?
Well, I guess the first thing I would say is I encourage everyone to get tested at Redwood Acres because it is an important part of our surveillance. And I think that this is one piece of a possible exposure for residents in our community, but there are multiple possible exposures that we all encounter as we're moving about outside our homes. So I encourage everyone to get tested through the facility. Masking alone, again, masking is a help. It is not a 100% remedy. And so, again, it's just part of the activities that we do that increase our risk.
If people participated in the demonstrations this weekend, should they be getting tested and should they be self-quarantining?
Again, with this kind of exposure as opposed to exposure to a known case, we don't have people quarantining. However, I again just emphasize that I think testing is good for everybody. We know that most people, if they have an exposure, will become positive. That the typical is around day 4 to 5, and most everyone will become positive within about 2.5 to 10 days. We use 14 as our outlier because some people may be a little bit different, but I think doing some regular testing is important for everyone in our community.
Thank you. Are you expecting a spike in COVID-19 cases in Humboldt after the recent protests?
Again, I don't know. We've had many new things happening in our community in terms of gatherings, with some casino opening, with churches now gathering, with some of the things we saw over the holiday weekend in terms of people gathering. I certainly have concerns over the coming few weeks about what we might see in cases. This large gathering for protest is among those.
Another question along those lines. Do you expect to see a national spike in COVID-19 cases following the widespread protests? And will health officers use this data to determine how prevalent the virus currently is?
Well, again, certainly from some of the national images I've seen, many protests, there's been little adherence to masking or relatively little, depending on the state in which it occurred. And so I would certainly be even more concerned if I were a health officer in some of those areas. All the data that we gather in terms of testing individuals is important in us looking at prevalence in our community.
Thank you. Now that we've had the public relax its adherence to shelter in place over the Memorial Day weekend, followed by a weekend of hundreds of people on the streets of Eureka, by what extent do you expect the county's confirmed case total of COVID-19 to grow in the coming weeks?
I really don't know. Again, that crystal ball would be really good to have. I guess I just want to take the opportunity to remind people that as we try and do things to get our economy up and running and get people able to kind of resume more of their normal lives, that it's really important for us to limit the gatherings. I know it's difficult. I know we've all been doing this a long time. But, adding those gatherings on top of the things we're already just trying to do countywide just increases the risk of a sudden increase in cases. And so I just really want to ask people to hold on a bit longer and to really try and limit those exposures in group settings. Because we've seen in our recent cases, even relatively smaller groups of people from less than 10 to 20 can result in a large number of cases. And so it is really important to try and limit that.
What's the plan to prevent further community spread of the virus if large gatherings do continue?
Well, if gatherings continue, then we're really left with, I guess, two things. One is really counting on people doing some surveillance testing to pick up people who may be asymptomatic but infected. Because the earlier we're able to identify cases and really quarantine their contacts, the better chance we have of controlling the spread of the virus. So the second piece besides testing is our contact investigation, quarantine, and isolation. And again, one thing people have to remember is that our capacity to do this well is not limitless. We have built our capacity and we're continuing to do so, but it would be difficult to envision a time in which massive numbers of new cases are going to be able to be investigated, quarantined, and isolated quickly. And so it is really important to keep the increase in the number of cases relatively controlled so that we don't face that limitation.
Thank you so much. And do you have anything else that you'd like to add?
Well, again, it's been kind of a big couple weeks in terms of what's been going on. I think, again, I know some people have been confused by the discussions at the state level about where we are in our response and where we are at the local level. So I just want to remind people that, again, the governor has basically framed the roadmap is that the state is telling us how to open and that we are determining when. So the state is basically taking those stage 2 things that we've all been talking about and then adding the stage 3 items to the mix as well. And basically saying that as we provide guidances for these sectors, and as you are ready on the ground where you are, you can access these additional sectors. And so what we are doing locally is we're taking the lowest risk things, those things that were identified as earlier in stage 2, making sure those are up and running, and then really just following our data and trying to add in those additional things as we go. Again, it's important for people to understand that even if the things we're opening are lower risk, there's a different level of risk if you're opening 5 or you're opening 1,000 or you're opening 6,000. And so doing so brings more traffic, more intersection of people mingling within a setting and interacting with each other. So we really do need to pace ourselves. COVID is not going away anytime soon, and we really do need to make these efforts in part so that we protect our most vulnerable populations who, if there's less virus spreading quickly in our community, they are less likely to get exposed. And also, again, to protect our hospital capacity. We have not seen a surge of COVID yet. These small peaks, relatively smaller peaks that we've been seeing recently of cases and then a little bit of subsiding and then another peak, may be what we're going to see ongoing. However, at some point, one of these increases may just continue to go up. And that can happen if our ability to decrease transmission, is challenging. And so again, I just want people to understand there's a reason that we need to pace ourselves going forward. I think we'll be most successful in the long run at doing those two things, protecting our vulnerable folks and protecting our hospital capacity if we do this in a very thoughtful way.
Excellent. Thank you so much.
Thank you.